Okay, I have already verified my MER to my doctor's orders and made sure that the MER was correct with what the doctor has ordered. I've gone to the medication room and I've done my first 2 checks, and so now I have come to the patient's room. And so, knock, knock, knock. Good morning, my name is Jan Bucks-Kemper. I'm a registered nurse. How are you today? Good. And I'm here to give you a 9 o'clock medication, so let me get this rubbed in good so it activates it correctly. And I'm going to pull my chart up, and so I am looking at my chart, and I had verified it earlier, and so can you tell me, I'll put my cursor right there. Can you tell me your name and date of birth? Brad Smith, 4/24/1957. And I've got Smith Brad, date of birth 4/24/1957. And I'm going to go ahead and scan your armband. Okay, and that matches. And then, Mr. Smith, are you allergic to any kind of medications? Codeine, and I have codeine there. Okay, good. And what does codeine do to you? Just makes you feel crazy? Okay, well, we're not going to be giving you any codeine today. I'm going to go ahead and raise the bed up a little bit here. So I've got 1 medication to give you this morning, and so I'm going to do my 3rd check real quick, and then we'll talk about this medication, okay? So I have Smith Brad, date of birth 4/24/1957, Flonase 1 spray in both nostrils, BID. I'm giving the 9 o'clock dose. So I have Flonase, and expiration date is 1/20/2028, so it's intact, expiration date's good, and I'm going to give him 1 spray in both nostrils. So I'm going to go ahead and put my cursor there, and I'm going to go ahead and scan my medication. Okay, so we've done our 3rd check and we've scanned, okay, and so we're doing 1 spray in both nostrils. Okay, so Mr. Smith, this is a anti-inflammatory corticosteroid, and so it's to help relieve any kind of nasal congestion or irritation. We're going to be looking at any kind of drainage that you've had, and I'm going to go ahead and let you blow your nose unless it's contraindicated, and in this case it's not, so if you want to go ahead and blow your nose, okay. And of course I would have gloves on before I would let my patient blow their nose and touch their as I'm doing my assessment. I haven't touched it, so we're going to let you blow your nose, okay? And now, do you feel any stuffiness or anything like that? Okay, so this is to help with relieving that, but sometimes it can cause you to have some irritation, any kind of itching. It could cause some dizziness. So again, don't get up without letting us know, okay? We, if that's the case, we're going to put you on fall precautions with that. And so with this, we're going to take the lid off, and I'm going to go ahead and close 1 nostril, okay? And I'm going to just stick this right inside the nostril, and as I squeeze, I want you to inhale through that nose and count 1, 2, 3. Okay, ready? Squeeze. Inhale 1, 2, 3. Okay. And you're doing okay? If there was any kind, we'll dab that, and then we're going to do because we've got 1 spray in each nostril. So I'm going to include this one, and we're going to, okay, 1, 2, 3, squeeze. Inhale 1, 2, 3. Okay. And I don't want you blowing your nose. We can just kind of dab it there. And we're going to clean this, the tip of that, before we put the lid back on. Okay. So no blowing your nose for about 5 minutes. Okay. Sometimes it can have, you don't want to overuse. So this one is BID, so just twice a day. So if you use it more than that, if you go home, you're using it more than that, it can actually make it worse, okay? So you could get more stuffiness, but the whole purpose of this is to make sure that that you're able to breathe through your nose, okay? So anything, are you doing okay? All right, so I'm gonna do glove to glove, skin to skin. We'll do medical hand wash. And we're gonna go ahead and put your bed down to the lowest position, side rails up ×2, wheels are locked, your call light's within reach, okay? And I'm gonna go ahead and come over and document. And all I need to do is just initial that we gave you your Flonase and that it was one spray in both nostrils. I didn't really have to do any assessment. If I had, we just really just kind of made sure what kind of drainage and what that color and amount was on there. And then I'm going to come down here and I'm going to put my name, J. Bucks Kemper, my credentials. Why is that not doing that? Because I have my cap. Had the caps on. And then my initials. So this signs that I gave. So again, anybody that says JB knows that JB is J. Bucks Kemper. And so since I've signed my that I've given the medication and we've already done, then I'm going to go ahead and close my chart out. And I'm just going to go ahead and just decrease that right there. Okay, what are we doing here? Okay, so I closed out my chart. And is there anything else you need? I'm going to go ahead and leave you sitting up for a little bit, just so that you've got that down. And sometimes when you give this, you can feel the drainage in the back. You can feel that coming down the back of your throat, and that's normal too, okay? So if you need anything, just holler at us. I'll be back in 30 minutes to check on you, but if you need anything before then, just put your call light on, okay? All right. We will see you here in just a little bit.